on a night duty. I bent to take something and I felt this sharp pain. And I told a nurse, this thing, when I felt it, I touched, and there was this lump. And I told the nurse working with me, I felt this lump. She told me to let's go to the lounge. We went to the lounge where it was inspected by the doctor on duty. And he referred me to the surgical team and to have a mammogram. I did the mammogram, came back. A biopsy was done, and I was told within 2 weeks I would get the results. Well, it took a little longer than 2 weeks, but then when I received it, it said, I remember Dr. Greenidge telling me, Junie, it's cancerous. And this is something I know all cancer survivors go through. When you hear you have cancer, you hear nothing else. At the time you hear you have cancer, they're speaking to you, but you're not hearing anything else. And when that happened, I heard him, I know he was speaking, but when you hear cancer, though I worked at the hospital, I knew of a lot of different conditions, but I did not go in depth about cancer. And when I heard it, it's like, at the time, cancer is a death sentence. And it grabbed me. I went home. That was the longest ride home, I must tell you. And when I got home, I cried. I got a call from Mrs. Begas. I will never forget Mrs. Marianne Begas. She called me and she told me, Junie, you have to go to do the surgery, because Doc told me I had to come in the Monday to do the surgery on the Tuesday morning. I had to remove the breast because the lump found was 4 meters by 4 by 6 centimeters. So it had to be removed. I took a while and I couldn't move, and Mrs. Begas said, no, you have to go. Dr. Dena Gomez, I have a lot of people to mention. Dr. Gomez, Dr. Edwin, a few of them called me and told me, no, you have to come in. I came in. I had the surgery done. It is 19 years now. 3rd of May was 19 years. And I had the surgery done. I started chemo in Canada, but then they cut me off and told me I can do natural stuff because I got it early.
Okay.
I have been on the ground working, as Marianne used to do, working with breast cancer survivors or patients. And I would like to state, you have to do your self-exam. Do your breast exam, self-exam. And in the event you find anything that is irregular, go to your nearest wellness center. Now, I am proud to say that now they offer the free mammogram, because some people it was expensive for some.
Right.
So now it is free, and I would like, please do your self-exam, because women are very important. We carry a very big role.
Yes.
We are mothers, we are sisters, we are, and we still have to work. So please do your breast exam, and when you go to your nearest wellness center, after the screening is done, because they will screen you. After the screening is done, you are then given a voucher.
Yes.
Attached to your form that you take to the hospital, and from there you are taken care of. Early detection is key. I love to stress that early detection is key. You have to know your body.
Yes.
Early detection is key, and you can survive cancer. You can. And thank you to UHC. Now we have, I didn't go through that, I didn't get it, but I'm happy that now it is there and a lot of people can get it, because breast cancer is very common and males get breast cancer also. So I'm happy for that now.
Nigel is checking, he's doing a self-exam.
It's good, it's
I'm
good.
looking and I'm
It's
seeing.
good.
So how do you go about doing the self-exam?
You lift one hand.
Yes. Let Nigel come on. Let's lift one arm. Yeah.
And you take it from here and you go clockwise right around,
Okay.
That is good.
and anti-clockwise, you go the other way.
Okay.
And you do the feeling of the entire breast
Okay.
and the area.
Yes.
Now don't be fooled, because under your arm also you can get breast cancer.
Right.
The lump can be under the arm.
Yes.
So you also have to do, yes.
You didn't know that?
You also have to do it under the arm to feel if anything is abnormal there.
Okay. Okay.
And if anything is, you face your nearest wellness center.
But isn't the breast normally lumpy a little?
Yes, there are times
So-
the breast is lumpy, but if you know your body, you will know the
Yes.
difference.
Right.
You will know the difference. There is lumpy, and you should always liaise with a doctor. You know, some family practitioner, because when we were growing up, we always had a family practitioner.
Yes. Yes.
So you always liaise with a family practitioner, where you can always, if you have lumpy breast, and especially around your period, it may be lumpy, a
Yes.
little more lumpy, but you have to know your body. You know, you have to know your body.
Yes.
So when you find anything irregular, go to your nearest health. The sooner, the better.
Okay. Let's speak about the emotional toll that breast cancer takes on women and men. Let's speak about that, because we know that UHC has provided access to the care. They've provided that preventive care, if you will. I want you to follow up that with what are some of the areas in which you think we can further expand the service as a breast cancer survivor. But let's speak about the emotional toll of it.
Well, it takes, there are some people, because I have dealt with a lot of cancer patients, there are some who just tell themselves they're going to die and they're going to die. You have to face it on a spiritual level also.
Okay.
Because tell yourself, your mental state has a lot to do with it. Yes, you're going to feel like, whoa, you dreamed. Like I said, when you hear you have cancer, you hear nothing else. So that alone tells you you are emotionally blocked out of anything else. You feel like, oh my God, where do I go from there? And again, there's some people, it's according to who is doing the surgery. You have to be all of this comes into mind. And you have to be somebody, you have to give yourself, you have to be emotional. Well, you'll be emotional, but you have to be, I will not say religious. Like I said, you have to be somebody that is spiritual, that could comprehend. Because if you're going to tell yourself you're going to die, 90% of the illness is in the mind.
Right.
If you tell yourself you're going to die, you're going to die. If you tell yourself, I'm going to beat it. Yes, you will have the breakdowns, because with cancer patients, you will have breakdowns. There are times you have emotional, you feel emotional, you're down, you don't want to speak to people, you want to be isolated.
Yes.
These are some swings that you have with cancer. But once you have a support group, and that is very much needed. When someone is diagnosed with cancer, they need an entire team. I was speaking to Dr. Tamara Remy, and we were saying the same thing. They need an entire team, not only the doctor. You need an entire team to work with you at that time. You don't need sympathy. We don't need sympathy. We need empathy. Okay? You need an entire team. You need the counselor. You need the radiographer. You need, you need different people to work with you so that you can settle. Because at that time, support is needed. Support group. I had a strong support group in my children. I must say, blood relatives, I couldn't rely on that. But my children, I could rely on, and I had a family at Victoria Hospital. We just had a reunion, and I don't even think they know. My family, we were a family at Victoria Hospital. Nurses, doctors, everybody. We were a family. So they were a support group. Everybody was there for me. You know, lab, name it. They were there for me. You know, so I had that support. And you need, as a survivor, you need the support. Because you're going to have emotional mood swings.
Yes.
You're going to have, and still you have to deal with your daily problems.
Right.
Day-to-day problems. So you need that support group, that support. And I had it in, up to now I have it in nurses. My reason for being here is one of my support groups, Dr. Alicia Eugene. One of my supports, you know, for years. And, you know, you need the support. They need that. So what we can do further is, instead of the person going to just the oncologist, or you have to have the oncologist, an entire team.
Yes.
They have to start building a team so that when the patient comes in there, when they leave, they feel relieved. They feel like, okay, I have something to fight for. I'm going to fight. You know, if they don't feel that, forget it. They're going to go down. Because I have seen people go down, and there are even people who think they cannot do without. They were given oxygen. Two patients in particular, they were given oxygen at the time they were hyperventilating. They were given oxygen, and they told themselves they cannot live without it. When it was taken away, one went, and within short space of time, she was dead. Right? But then you have to, as I said, the support. Let them know, because I always tell people, anytime, the doctors used to do that. A lot of doctors used to, when someone is diagnosed, call me to speak to them. Yeah. You see, that alone is a good help. Because knowing that you are not alone, I am there with you. I am there for you. You can call me, and I can always answer some questions, you know, that you may find pertinent questions, and that can help.
Now, that would have been my next question, which would have been, given your experience at the Victoria Hospital, you said 30 years. I'm sure that you've seen all walks of life,
yes.
all sorts of illnesses, everything.
Yes.
But since we are speaking, about breast cancer, I just wanted to know, from your perspective, being a survivor and then seeing individuals, those who come in, get the diagnosis, or those who are ongoing treatment, what is that experience like? Paint a picture for us.
You mean seeing them?
Yes.
I tend to tell myself, June, you had that support. You can be supportive to them.
Yes.
I tend to then go to them and try to break them down, because let me hear how you feel in connection with your diagnosis. And if I'll tell you, no, my darling, there's life after cancer. You can deal with it. We have drugs to deal with it. There are ways and means to deal with it, and you can survive it. I can tell you this because I've been there.
Yes.
I've been there. And, you know, a lot of patients have gotten a lot of strength. Recently, somebody came to GIPC where I work, and she said, I listened to you, and I got a lot of strength just listening to your story and seeing your strength. And I said, thank you, Lord, because this is what I don't want to pray. You see, this makes me feel good.
Yes.
Because somebody learned from me that, yes, you can deal with it. Don't give up. Deal with it. And I always tend to be there for them, try to tell them, do not break down. And there are some people who will look simple. Oh, don't do this. Don't do. No. We don't want sympathy. Like I said before,
Yes.
we need empathy. Be there. You know. So I always give my number to those persons and tell them they can call. I will speak to you. I will explain to you. You know, all breast cancers are not the same.
Yes.
Because, like I said, there are times you get it under the arm. All breast cancers are not the same, but at least the feeling, the emotions are always the same.
Right, right, right.
Because you get something and you tell yourself you have a deadly disease. You're going to die, especially if you know nothing about it. Now there's Google, Google it.
Yes.
You know, well, I researched a lot after I was diagnosed, but then, you know, as I see people, I empathize. I always sit with them, take time, sit with them, and tell them, find out what their experiences are and whatnot. And the most daring is sometimes they live alone. Well, I live alone, but I know there are people I can call and I can relate to. But there are some people who are alone, and this is what is bad, you know, because they have some don't have anybody, any family support, any. So I would like to be there for some people who do not, you know, have it. We can meet, sit, talk. And when I leave you, I want to know that you're much better. I want to see a smile on your face. I want to see, you know, you feel better. You know, so this is what I would like to see happen. The team,
Yes.
when someone is diagnosed, see a team of people,
A
not
great
just
support
one person.
network.
A support network.
Okay. Now, when we speak about the service of mammography breast cancer services under universal health coverage, I can say in going out into the public and speaking to women, even my friends, I would say to them, we have this free service, or it comes at no cost. There's a new 3D mammogram machine. Recently, Sienna Regis was here with
That
us.
is one of my support groups.
Yes.
That's my darling.
And
It's
she
one of my
spoke-
support.
She said that it's not as painful.
Because a lot of women
Yes.
run away from that, even
Yes.
I, because I did not have a very good experience with a mammogram once. Though I had already lost one, and the other one, this thing, it can be traumatic sometimes, you know, because you get this, they have to be pressing down on the breast to get the picture.
Right.
They have to get the picture. So some people are afraid of that.
Yes,
So now that they have the 3D,
it's less
less
painful.
painful.
Right. So how do we encourage women to actually take that step to go and access the mammogram, the 3D mammogram? What would you say to a woman who is anxious about it?
I have not think myself. I do not know it myself. But then I would tell somebody, take advantage of it. Number one, you don't have to pay for it. You don't, and you're going to get professional service. Take advantage of it, because with the 3D service, I don't think you have this painful.
No.
So go ahead, take advantage of it, and make sure that you take care of yourself, because you have one life you have to live.
Yes.
And you have to take care of it.
Yes.
Yeah, and the better you are, if you have children, you can see your children grow, your grandchildren. Come on, you know, it's worth it. It's worth going to do it.
And let's talk about, you mentioned it earlier, life after cancer. What is that like? I suppose there may be a period of reintegration, I guess, into normalcy, or what is perceived as normal life. Or is it a completely different perspective that you have on life after surviving cancer?
I must say, there is normalcy and a total different perspective, because you are given a second chance. I look at it, I was given a second chance. There is something that I have to do. There's something I have to prove. There's something that I have to prove, that you can survive a lot of things. Cancer is one. You do not think that because you have breast cancer, you're going to die. No. There's life after that. Look now, more and more scientists are coming up with more and more ways to deal with it. And a lot of times I read, you don't have to die from cancer. You don't have to die from cancer. You have to take care of yourself. It starts with there.
Yes.
You have to check yourself, make sure you're okay. Anything abnormal that is not supposed to be there, check with your doctor,
Yes.
your nearest wellness center, and see where it goes from there. And be optimistic. Be optimistic. Okay, I'm going to take care of myself because I need to move on. I have things to do. I have a goal to achieve. I have things to do. come on, you continue and you tell yourself, yes, I have goals in life. I need to do that.
Yes.
Yes.
Okay. Now, Dr. Eugene just wanted me to share a few pointers for our listeners and our viewers. One may ask, what age do we do mammograms? We start at age 40 years and we'll go up to 74, 75 years. However, if a patient shows signs and symptoms that warrant a mammogram, plus a strong family history, we will see the patient even if they are younger than 40 years for the mammogram. And despite the ages, women are all encouraged to examine their breasts. As Ms. Mitchell indicated, the self-exam is important, and doctors and nurses will also do a clinical breast examination, which may be followed up by a mammogram. Now, this is a very brief show, but we try to make it as impactful as possible. We know that many people go back and they look at the show and they try to learn something from it. Now, what would be your final message to our listeners and our viewers here on NBC Real FM?
Before going forward,
Sure.
I understood the age for mammograms is 40. I have dealt with patients earlier than that.
Yes.
They are younger than that. And do not feel because you are not 40 to do the mammogram you cannot go. You can go because there's the ultrasound.
Yes.
They can do the ultrasound of the breast. Okay? So you can go and do it. All right? So there's always a way to help yourself and to go forward and see what is wrong.
Right.
Okay? Before. And always go to your wellness center. Check with your nurse. Even if you don't get a doctor, but you get a nurse. Sometimes you have very qualified. We have some experienced nurses at different wellness centers.
Yes.
That knows exactly what to do. So you go in there and you make sure. And please always check yourself, because this is, especially if you have a history. Oh yes, always check yourself. Always do your. But I think that it's not about a week after your period.
Okay.
You do it. And always do your breast exams, and always check up on yourself.
Okay. All right.
Take care of yourself, because you only have one body.
Yes. Thank you so much, Ms. Mitchell. You really shed a lot of light. It is very different when you have somebody who's actually gone through it,
yes,
as opposed to a technocrat.
Yes.
When the technocrats come on, it's important as well because they have the information. But when it's somebody like yourself, you look like us and you talk like us and you have the experiences. Look, you're going to work right now,
yes,
at Grozili Polyclinic.
Yes.
So people can relate,
yes,
to that. So we really appreciate you coming on to the show.
I love to sometimes,
yes,
if you can do it, I can do it too.
Yes.
This is what I need.
Yes.
If you can be like this after 19 years, I can do it too.
Excellent. Thank you so much for
You're
your
most
time.
welcome.
And to our viewers and our listeners on NBC Real FM. I know we are on many platforms, even YouTube. So Twitch, YouTube, Facebook, everywhere. Those of you who have tuned into PHI, thank you so much. We did take a little break. I was on vacation, but I am back now. And as you know, next week we will... What, Nigel? As you know, next week we will be discussing the St. Jude Hospital. I am no longer saying the reconstruction project because reconstruction is complete. So we are discussing St. Jude Hospital and that imminent opening date, which I know you are all looking forward to. Therefore, tune in next week to PHI. This week we discussed universal health coverage, mammography services with a breast cancer survivor, Miss June Mitchell. She has 30 years experience, almost 30 years experience at Victoria
Hospital.
Now she's at GIPC, and she really helps people out. And I'm sure many of you are familiar with her. If you, most of us have gone to, yes, a lot of work on the ground indeed. So thank you so much for tuning in. If you are just tuning in, of course, it's only half an hour. Go back, listen, learn, and put your health first. Yes. Do have a wonderful day. See you next week.
It is well known that diseases like diabetes, high blood pressure, and other illnesses may restrict blood flow, which can lead to impotence and erectile dysfunction. This is why Enhance was formulated to meet these challenging health problems, which can reduce your ability to perform. If you're having problems maintaining your manhood, then reclaim your